8 European nations and 1 Asian nation, the United States and Iran, are amongst the 10 most affected countries. Most European countries and the United States are currently witnessing a surge in the number of cases. So how equipped is the healthcare system in each of these nations? Let's take a look. Now, the crisis has brought, believe it or not, the United States, the world's most powerful nation, virtually to its knees. The country has registered close to about nearly over 400,000 cases, with over 11,000 deaths so far, according to the Organization of Economic Cooperation and Development. The country, believe it or not, we are talking about the United States here, has a meager 2.7 beds for 1,000 people and about 2.6 doctors for a similar number of patients. Now, the average health spending by the government per person stands at $8,949 per annum. By far, this is the highest for any of the affected nations in the world. Let's now shift our attention to what is happening in Spain, for instance. The public sector is the major source of health funding in Spain. Its healthcare is ranked as one of the best in the world by the World Health Organization. Yet, it has today the highest number of coronavirus cases in the whole of Europe, with over 137,000 infections being reported and close to about 13,500 deaths. The country is close to 4 doctors for a population of 1,000 and just about 3 hospital beds for about 1,000 people. The nation spends $4,500 per person per annum on healthcare. In neighboring Italy, the healthcare system is also ranked as one of the best in the world. In fact, it is ranked as the second best in the world. Now, according to Lancet, Italy has Europe's highest life expectancy, which means that the country has a high level of an aging population. Now, this is precisely the reason as to why the virus has claimed the most number of lives anywhere in the world. Now, currently, Italy has reported over 16,500 deaths with about 133,000 infections. There are about 4 doctors per 1,000 people and about 3.2 hospital beds for 1,000 people. Now, the national spending on healthcare per person is said to be $2,500 per year. Now, in the case of Germany, the virus has, of course, hit Germany with force, pretty much the same force like its neighboring nations. But with under 2,000 deaths and over 100,000 confirmed cases of infections, Germany's fatality rate is said to be the lowest in Europe. Now, the nation's track record of its health care is one of the best, with over 4.3 doctors per 1,000 people and as many as about 8 hospital beds for 1,000 people. Now, the annual health spending of $5,056 is what has been reported per person per year, is also one of the highest amounts of spending in the health sector in the world. Now, the World Health Organization found that France provided the best overall health care in the world, and yet with close to over 100,000 infections and 9,000 deaths, the country has seen a resurgence in the overall fatalities in the last few days. Now, France's track record when it comes to doctors and beds per person is one of the highest in Europe, with the state on an average spending $4,100 per person per year on healthcare. Meanwhile, let's take a look at what the situation is in China, the country where it all started. Now, there's been a resurgence of imported cases. The Chinese administration is describing the fresh cases that are being found in China as not having been locally transmitted, but those cases that have been brought in from other countries. And the nation fears a possible second wave of the deadly virus if it is not curbed. At 81,740 cases and 3,331 deaths, China's spending on public health care is just under less than $400 per person per year, which is one of the lowest in comparison with some of the other affected nations due to COVID-19. There are also about 2 doctors for an average population of about 1,000 people. Now, according to an estimate, at least about 6 people die every hour in Iran from COVID-19. The Islamic Republic has become a coronavirus epicenter in West Asia, with the death toll surpassing 3,700 and cases topping 60,000. Now, Iran has also been accused of playing down the number of cases. Now, there is at this point of time not much data to support the healthcare spending of the state on its citizens in the number of doctors and beds per thousand of a population. And this is said to be at this point of time just 1.5 doctors for 1,000 people and about 1.6 hospital beds for a similar amount of population. Now, the United Kingdom's National Health Service has a reasonable claim to be one of the most efficient healthcare systems anywhere in the world. In the year 2017, according to a report by the Commonwealth Fund ranking developed country healthcare systems, the United Kingdom was ranked as the best, as having the best healthcare system in the world. And yet, with over 51,000 cases and over 5,100 deaths, the United Kingdom is grappling with coronavirus infections like no other nation, with its own Prime Minister having been admitted into an intensive care unit due to the infection.